Good morning, everybody, and welcome to this morning's Wellness at Home Workshop, Part 2. Uh, Last week, I got cut off at the end of my workshop, but today, seeing as how we've pretty much figured out how much time we're going to be doing for workshops and stuff, I've now figured that out. So, I'm going to be making sure I speak nice and loud today because I think the other video was a little bit quiet for those of you who weren't able to hear. Now, before we begin, I would like to just go over a few housekeeping topics. So just to remind you guys, one, workshops are required. We do expect you to be participating in these workshops, especially now that we're making them online and you're able to access them at home. That's the beauty of being able to actually do online workshops. We can actually provide those for the clients who can't make it to every workshop. Now everyone is able to make it to every workshop because you're able to access it at any point in time, wherever you are, whatever you're doing. You can listen to the workshop when you're out running errands, just put your headphones in. You can listen to workshop when you're taking a moment at home, hanging out with your family, right? So make a time, take 30 minutes out of the day. We would prefer that you guys join us every Tuesday and Thursday from 11 to 11:30 for our workshops, but if you can't, that's okay and that's understandable. Not everybody can make that specific time. It's just really nice for you to be able to make that time because, as I had said before, Jennifer, Sadie, and myself are watching this workshop along with you guys and are available to answer any questions for you guys at that time. And usually it's just really nice. It keeps the flow of everything going. But again, if you can't watch it at another time. But we do expect you guys to watch all of the workshops that we do post online because we are creating these for you guys. Okay? Another housekeeping topic, our Facebook page is where we're also going to be posting any information that we come across that would be useful to you guys, not only in regards to employment, but just some mental health resources, maybe some workouts that we find out online that we can post. We'll post whatever we can find that we think would be helpful to you guys. Another thing, we do want you guys to be checking the Facebook page daily. We want to make sure that you guys are aware of what is happening in regards to workshops on a regular basis. As long as you check the web page or the Facebook page daily, you will be updated on everything that is going on, when it is happening, and what is happening. Okay? So, this workshop, I think we'll only have 2 more sessions of it, and then we'll be moving to another topic. So guys, this is your time. We want you to also post during this video what kind of workshops you would like to see us present as well. Some people have said that, this workshop is not suited for them, and that's okay. We want your ideas. Give us some ideas of some things that we can present that we maybe haven't discussed before. Moving forward, we will be going over cover letter creation. We'll be going over resume creation. We'll be going over communication, teamwork, right? There's a few ideas that we already have for workshops for you guys. So with that in mind, again, please, even if we do already have it written down, please suggest to us what it is you guys would like to see for workshops or what you would like to see presented. All right? It helps us get a better idea of what you guys are thinking and what you guys are wanting to learn at this time. Again, everybody, welcome and thank you for joining us this morning for our job search workshop, which is, this series is Wellness at Home based. Okay? Sorry, my Siri just turned on. This phone, it's very silly. Okay, so I'm going to continue on from the slide that I left off of from last week. Last week we had finished at who is most at risk. So I'm going to just start from the beginning of that slide and work my way down, and this time I will make sure that I stop at the right point so that I'm not cut off, and then we will continue on with part 3 for Thursday at 11 a.m. Okay? Awesome. Oh, and one more housekeeping item. I will be emailing you all your updated calendars for April. If you have a printer at home and you're able to print it off, please do so and put it in your job search folder. If you don't, just make sure that you refer back to it and it will be in your email by the end of this week. Okay? Awesome. Thank you guys. So let's begin. Who is most at risk? While COVID-19 can make anyone sick, some Canadians with specific health circumstances are at an increased risk of more severe outcomes, including individuals age 65 and over, have compromised immune systems, and have underlying medical conditions. In addition, social and economic circumstances may also be a factor in identifying someone who is vulnerable to COVID-19. This includes anyone who has economic barriers, difficulty accessing transportation, difficulty accessing medical care or health advice, unstable employment or inflexible working conditions, insecure, inadequate, or non-existing housing conditions, ongoing specialized medical care or needs specific medical supplies, social or geographic isolation, like in remote and isolated communities, a difficulty reading, speaking, understanding, or communicating, ongoing supervision, needs or support for maintaining independence, and difficulty doing preventive activities like frequent hand washing and covering coughs and sneezes. So the last area that I had finished explaining before I got cut off last week was social or geographic isolation. So those are areas that are remote, and I was talking about the rural areas in our community, the areas that don't have police stations or don't have hospitals directly in their towns. That would be places like Delburn or Ponoka even, right? Black Vault, they're not far, but they're still in a community that doesn't have those direct medical services. They need to drive about 20 minutes, 15 to 20 minutes either way to get medical services, right? So remote isolated communities like that. A difficulty reading, speaking, understanding, or communicating. So you know what, some people can't read some of the signs that are posted outside of the store. Some people have a difficulty communicating what it is that they need when they come into a store or into a hospital, but if they have support or family, then hopefully they can. But what about the people who don't have that support, right? Who would usually depend on their support worker who is unable to go out in the community with them at that time. So there's also difficulties in those areas. Ongoing supervision needs or support for maintaining independence. So a lot of you guys, or a few of you guys, are in supported independent living program. Right now we are running, but they're running in a different sort of way. If we can provide the services to you that you need without having to come in contact with you, that works better and is probably safer for both you, the client, and us, the staff, at this point in time. But our SIL team is still working really hard to make sure that you guys are getting everything that you need and any help that you need. So please feel free to call them. You know who they are, Jen Lupanko and Ms. Joanne Posner. So if you do need anything from your SIL workers, make sure you talk to them. Make sure you give them a call or a text and find out if they can help you with a way to access your groceries where you don't have to go into the grocery store, or if you need support with your budgeting, contact them, guys. And difficulty doing preventive activities like frequent hand washing and covering coughs and sneezes. So I'm not too sure why too many people would have a difficulty doing this, but maybe somebody is too young. Maybe it's a little baby and they're not paying attention to when they cough and sneeze, and they're just coughing and sneezing, right? Maybe you're one of those people that just is forgetful sometimes and forgets to cover your mouth when you cough and use a tissue or cover your nose when you sneeze, right? It really does depend. So maybe you're in a wheelchair and you can't move your arms, right? What do you do then? There's only so much we can do as human beings, especially when you're in a specific condition, for you to be able to do the things that everybody else does, right? So keeping that in mind, there's a lot of people who are at risk who aren't able to do a lot of the things that the rest of us are able to, or are just compromised just because of their age or their health situation. Moving on to the next part of our new normal, the new normal part 4. With the government doing as much as they can to stop the spread of the virus and the risk associated with getting the virus, we have to do our part to help. Okay, so let's first discuss the difference between self-isolating and isolating. I have now attached my links to the slides. So when we've completed this PowerPoint, again, you guys will be able to have access to this PowerPoint. It's no problem at all. You just gotta let me know if you want a copy of it and I'll email it to you directly. Okay? Perfect. So we're going to be talking about how do we prevent the spread of the virus. How do we do that in this next part, our new normal? Quarantine, self-isolate versus isolate. There's a difference between advice to quarantine, self-isolate, and advice to isolate. These measures are in place to protect the health and safety of Canadians. So, quarantine, self-isolate. Quarantine for 14 days if you have no symptoms and any of the following apply. You are returning from travel outside of Canada, mandatory quarantine. You had close contact with someone who has or is suspected to have COVID-19, or you have been told by the public health authority that you may have been exposed and need to quarantine. Okay? So those are the reasons why you would need to quarantine, self-isolate. Those are the reasons why you would be required to do so. Isolation, which is what we're in right now while we're all staying at home. So you must isolate if any of the following apply. You have been, I take that back. Let me read my slides first before I take a jump and start explaining something. So isolate. You must isolate if any of the following apply. You have been diagnosed with COVID-19 or are waiting to hear the results of a lab test for COVID-19. You have symptoms of COVID-19, even if mild. You have been in contact with a suspected, probable, or confirmed case of COVID-19. You have been told by public health that you may have been exposed to COVID-19, or you have returned from travel outside Canada with symptoms of COVID-19. So, self-isolating, quarantine versus isolate. Anything in regards to maybe you having contact with COVID-19 or you having symptoms of COVID-19 or you've been around someone with COVID-19, this is why you guys have to quarantine or self-isolate in those specific situations. Preventing the coronavirus. So, Canadians should continue to think ahead about the actions that they can take to stay healthy and prevent the spread of COVID-19 in Canada. This includes staying at home as much as possible and being prepared in case you or a family member becomes ill. Everyone should be practicing physical, social distancing. Even if you do not have symptoms of COVID-19, you could become infected by others, okay? So as we continue to see transmission of the virus within different communities, we know that everyone must take precautions, even those who have not traveled outside of Canada. In an effort to prevent the spread of COVID-19 within communities and across the country, all Canadians are advised to stay at home unless you have to go to work. Talk to your employer about working at home if possible. Avoid all non-essential trips in your community. Do not gather in groups. Limit contact with people at higher risk, such as older adults and those in poor health. Go outside to exercise, but stay close to home. If you leave your home, always keep a distance of at least 2 arms length, approximately 2 meters, from others and household contacts. People you live with do not need to distance from each other unless they are sick or have traveled in the last 14 days. I can understand that can be difficult for people who live with people, right? How do you quarantine or self-isolate when you live with somebody who hasn't been on a trip? Everybody in the household has to self-isolate, unfortunately, or quarantine, okay? Do not gather in groups. So make sure that you're not going out to the movies with a bunch of people, which you can't do because the movies are closed, right? If you're going for a walk, don't go on a walk with a group of 6 to 8 people. Go on a walk with you and the person that you live with, or alone, right? It's okay. It's okay to do that, all right? And make sure you don't travel outside of Canada. Stay safe, guys. Stay here. Stay within Canada if you possibly can, okay? So, now they're talking about some things that you can do outside of your home. Some ways that you can keep your mind active, like go for a walk. So you can go for a walk. If you have not been diagnosed with COVID-19, do not have symptoms of COVID-19, have not traveled outside of Canada in the past 14 days, are not in quarantine, self-isolating, or are not isolating. If you go for a walk, do not congregate and always practice physical social distancing by keeping it at least 2 meters apart from others at all times. Okay? So you can go for a walk, right? That won't hurt. It's helping prevent the virus, but it's also letting you get out of the house and have some fresh air. Hygiene is a great way to prevent the virus. So, proper hygiene can help reduce the risk of infection or spreading infection to others. Wash your hands often with soap and water for at least 20 seconds, especially after using the washroom and when preparing food. Use alcohol-based hand sanitizer if soap and water are not available when coughing or sneezing. Okay? So I know everybody's been really anxious about this hand sanitizer thing, and a lot of stores have been out of rubbing alcohol. Just letting you know, guys, soap and water is the number one way to keep yourself clean. Washing your hands consistently throughout the day, even when you're at home, will help prevent the spread of the virus. Hand sanitizer is great for when you're out, but if you're at home, wash your hands, right? It's a good practice to have anyways. We should be washing our hands every time we use the bathroom. We should be washing our hands if we've gone outside and we've touched a whole bunch of random things. Wash your hands, okay? Cough or sneeze into a tissue or the bend of your arm. This is the bend of your arm, okay? Not your hand. Don't sneeze or cough into your hand. Again, we touch our faces so many times within the day that, you know, sometimes you're not paying attention to what you're touching, where you're touching. Sometimes you touch a doorknob outside and then you don't want to do that, right? So sneeze or cough into a tissue, sneeze or cough into a sleeve, right? And then as soon as you're done that, as soon as you're close to a sink, or if you have hand sanitizer, use it or wash your hands. Dispose of any tissues you have used as soon as possible in a lined wastebasket and wash your hands afterwards. And avoid touching your eyes, your nose, or mouth with unwashed hands. My hands are washed. I wash my hands at least 3 times every hour. So for me, just I'm not even touching my face even as I describe that stuff, right? Just because I don't want to, but if I do, my hands are washed, they are clean. Even my keyboard, all of the things that I'm using, they're cleaned down. So you guys do the same at home, okay? Beautiful. So moving on to cleaning. Coronaviruses are one of the easiest types of viruses to kill with the appropriate disinfectant product when used according to the labeled directions, okay? Health Canada has published a list of hard surface disinfectants that are likely to be effective for use against COVID-19. Although they do not claim to kill COVID-19, cleaners can play a role in limiting the transfer of microorganisms. Health Canada recommends cleaning high-touch surfaces often, using either regular household cleaners or diluted bleach. This bleach solution should be prepared according to the instructions on the label or in a ratio of 1 teaspoon per cup. Directions are based on bleach that is 5% sodium hypochlorite to give a 0.1% sodium hypochlorite solution. These services include toys, toilets, phones, electronics, door handles, bedside tables, and television remotes. So like I said, I disinfect all of my electronics every day, right? And that's just to make sure that I'm keeping and preventing the spread of the virus in my house at all. I make sure that I disinfect my doorknobs, my handles, even my windowsill handles I clean, the sticks for the windowsills I clean, my taps, I clean those regularly, even though they're cleaned really well regularly, but I do at least try to do that daily as I'm using my taps on a regular basis. Even though it's just my hands, I still have to make sure that I'm staying safe, protecting myself and protecting anyone else who may come in my house, okay? So make sure you guys do the same. For a list of the hard surface disinfectants that you can use, again, when I've completed this PowerPoint, there will be links attached to this PowerPoint. Each link on each section will take you to the web page that I use to get this information. And any of the highlighted stuff you see in the PowerPoint, they will also be highlighted on the alberta.ca website. So So if you click on that highlighted part on the website, you'll be able to access the list of hard surface and disinfectants that you can use. They also have a list of alcohol-based hand sanitizer that you can use that you'll be able to access online as well. And again, any of the information that I'm providing to you guys today, you'll be able to find online at alberta.ca. Okay, so wear masks. So this is a new thing where wearing a mask is very much accepted. So if you guys do have a mask, awesome. If you need to make a mask, again, there are blue links attached to the PowerPoint, but the links that I've also attached to the PowerPoint, they will take you directly to the page where the highlighted blue links will work and will direct you to the source of where you can guidelines on making your own mask. Okay, so medical mask, including surgical, medical procedure face masks, and respirators like N95 masks must be kept for healthcare workers and others providing direct care to COVID-19 patients. Wearing a non-medical mask or face covering while out in public is optional, okay? If you do choose to wear one, refer to our guidelines on wearing non-medical masks and how to make your own. Mask alone will not prevent the spread of COVID-19. You must consistently and strictly adhere to good hygiene and public health measures, including frequent hand washing and physical social distancing. Okay, so again, guidelines on wearing non-medical masks and how to make them on your own, they can be found on Google, or if you need a more direct, appropriate source, alberta.ca, in preventing the spread of the virus, you will be able to find it there. Okay, awesome. If you are having a trouble finding this link or accessing the link, please reach out to either myself, Jennifer, or Sadie. We can access the link for you and copy and paste it and put it into your email and send it to you if you're having a difficult locating anything that I'm talking about in this PowerPoint. Okay? We have no problem helping you with any research you need to do on any of the things that you're curious about throughout this PowerPoint. So just let us know and we'll help you out. Okay. Risks of getting coronavirus. Okay, so I know people have had concerns about them themselves catching the virus. So here they discuss some of the risk of getting the virus. COVID-19 is a serious health threat, and the situation is evolving daily. The risk will vary between and within communities, but given the increasing number of cases in Canada, the risk to Canadians is considered high. This does not mean that all Canadians will get the disease. It means that there is already a significant impact on our healthcare system. If we do not flatten the epidemic curve now, which means try to kill the virus out right now, right? Keep it where it's at. Make sure it's not going any higher or any lower. The increase of COVID-19 cases actually, we just don't want it to go any higher. We want it to drop lower. We want to flatten the curve. We want it to be basic, basically nobody getting it. So the increase of COVID-19 cases could impact healthcare resources available to Canadians. The risk of COVID-19 may be increased for certain settings such as cruise ships, crowded areas such as public transit and shopping centers, beaches, right? Gatherings, spiritual and cultural settings, theaters, sports arenas, and conferences. Okay? So, if you guys can manage to stay out of those areas and not attend a whole bunch of events where about 10, 20, 30 of your family members are attending, like family reunions probably wouldn't be a good idea right now, even though summer's coming up and I'm sure some people do have family reunions. Take a step back. Remember that we're trying to make sure that the virus is dead and that the spread stops, right? We want to try to make sure that it stops so that we can get out of our houses and get back to our regular lives. And the sooner that the virus is ended, stopped, moved on, then we can move on and continue on with our lives outside of our homes. Check if you have been exposed. Have you been on a recent flight, cruise, train, or at a public gathering? You can check the listed exposure locations to see if you may have been exposed to COVID-19. So if you need to if you wanted to find out where specific locations are even of where COVID-19 has been spotted or quite a few cases have happened, again, alberta.ca does have a list of exposure locations that I'm pretty sure they're updating daily on their website. Okay, so again, if you need help accessing any of these links after we have emailed you the PowerPoint, just let us know. Okay, so I got about 5 minutes left, and instead of me rushing through the next slide, I'm just going to go over a couple of housekeeping things one more time. Okay, so I'm going to end there today. So the last slide that we finished on, guys, was the slide about the risk of getting coronavirus. On Thursday, when we continue our workshop, we'll be finishing off this series of workshops in regards to the virus and wellness at home next week, Thursday, from 11 to 11:30. That will be part 3 of this series, and then it will be completed. That is what I am planning to happen. I may go a tiny bit over, but even if I do go a tiny bit over, this workshop will be done next week. Okay? So, our next week's PowerPoint, moving on, will be vulnerable populations, travelers, and pregnant women. How the virus is affecting those people, what the risks are with those people. Okay, so again, just to cover up some housekeeping as I'm getting close to the end of this PowerPoint for today, I just want to make sure that you guys please watch the video. Okay, us as your staff will be asking you questions about the PowerPoint moving forward. All right, we want to make sure that you guys are at least listening to the information that we provide you. You don't have to agree with it. You don't have to, not everything is going to be for everybody. Not everything is all the time. If you do have any questions, please, guys, I want to remind you that is what you have us as your staff for. Jennifer, Sadie, and I are willing to answer any questions that you may have in regards to this PowerPoint, anything that's going on, anything that will be presenting in the future. We will take any questions that we can, and we will try to answer them to the best of our ability. Again, our workshops will be every Tuesday and Thursday from 11 a.m. to 11:30 a.m. Okay? Again, we will be throwing watch parties so that we're all able to participate in watching the workshop at the same time every week. After I've posted the video, you can watch it afterwards as it stays on the Facebook page. After you have watched the video, we are requesting that you like the video and you let us know through text that you have watched the video. Okay? We can also check to see who has watched the video or who hasn't on Facebook. All right? So any of you who haven't been able to watch the workshop, we will be asking you if you have taken the time to, or if you were able to take a look at it at all. If not, we would be willing to watch it with you in a meeting, or at least set you up to watch it independently. Okay? Again, we are providing these online workshops for you guys as the day and age that we live in, the time that we're living in right now, is calling for us to utilize technology as we're all stuck at home, not able to work, not able to go out, not able to volunteer, have been laid off from our job positions. So with these PowerPoints being presented online, I really think this is a really cool thing because, you know, at the end of the day, all of you guys get the chance to access them. And we've never gotten the opportunity to get everybody to access the workshops. Usually we'll complete a workshop and then that's done, right? There's no going back. There's just the PowerPoint, right? But now we have video recordings of our workshops and we do want you to participate. So again, our next workshop will be on this Thursday, here on this Facebook page from 11 a.m. to 11:30. Sadie, Jennifer, and I will all be there during the watch party. This video will be posted at 11 and the workshop starts at 11. I can't wait to see you guys there, and I hope you guys have a wonderful rest of your day. Please continue to stay safe, stay healthy, and continue to participate with us. We're still your employment specialist, and we want to try to make sure that you guys are successful in everything that you do, even if you're stuck at home. Thanks for your time, guys.